I call the member for Blacktown.
Thank you, Madam Speaker. It's great to stand in this House after years in sitting on the other side in opposition and seeing wasted opportunities and half-hearted efforts by the previous Liberal governments for the people of the Blacktown electorate. We now have a Men's Labor government that cares and is trying to deliver the services and infrastructure where it is needed. Recently, the Minister for Mental Health, Homelessness, Housing, Youth and Water, the Honourable Rose Jackson from the other place, announced the implementation of a new policy for housing for mental health recovery. This first of its kind initiative for New South Wales is delivering purpose-built homes for people with complex long-term needs. For far too long, people with serious mental health challenges have been stuck in a cycle of hospital admissions. Some patients have spent years of their life in hospital, and we all know that is not the best way to live a dignified life. Pathways to Community Living initiative breaks this never-ending cycle of hospital stays without a viable solution. New homes will be built to provide a clear, supported pathway into stable, community-based living. This will be a holistic pathway to rebuild their lives in a real home environment with support they deserve. What makes this initiative different from what is currently available? This program is a combination of housing and around-the-clock specialist care, to 24/7 clinical and psychosocial support on site. The existing Habilis model has demonstrated significant social and economic benefits by helping residents to access regular medical support, which has resulted in fewer hospital stays due to improved treatment and a focus on physical health program. The Men's Labor government, under the stewardship of Minister Jackson and the wonderful caring staff of the department, have developed a more intensive model and program than the Habilis model. The Pathways to Community Living initiative is as close as to hospital care that you can get outside the hospital. This is to ensure people don't fall through the cracks as they transition out of long-term or repeated hospital stays. Construction is expected to begin next year, with the first residents moving in 2028. Ultimately, this is about moving away from institutional care and towards community-based mental health supports. It's part of a broader effort to shift New South Wales towards a modern, community-focused mental health system. This is the Labor way. One of the greatest premiers of New South Wales, Neville Wran, responded to the Richmond Report in 1983, which recommended the closure of large psychiatric institutions and proposed to transfer 2,500 patients into small community-based centres. At the time, it was controversial. It was unheard of to treat people with mental health issues in a community-based model. The scale and scope of the program was large and undertaken at a time when the government was under financial pressure with the recession that the country was in. Today's initiative has all the hallmarks of the Labor way of treating vulnerable people in our society in a caring and uplifting manner. But the Men's Labor government has injected substantial funding into this program. The Pathways to Community Living initiative is backed by a significant investment, forming part of a record $3.1 billion commitment to mental health and linked to broader housing and infrastructure programs that represent the largest push to improve support systems in the state's history. The Men's Labor government is delivering purpose-built homes for people with complex long-term mental health needs. There will be 60 supported places across Sydney and the Hunter, and I'm pleased with the announcement that 2 of these centres will be in Blacktown and Layla Park, each having 10 places, 20 out of the total 60 in the program. The residents are designed with private spaces, shared areas, and an outdoor environment to support the recovery of a 24/7 on-site clinical and psychological support. The initiative helps people transition out of long-term stay or repeated hospital admissions into supported housing. The goal is to support people to live more independently and in the community while receiving appropriate care. This mental health initiative shows that Labor is focusing on delivering the services to where it is needed. Thank you.
I call